Okay, so you start your alarm clocking. Ready? How many minutes did you say? 40? Okay. Hi, I am going to be your nurse practitioner student. Today, my name is Cindy. I'm from Seattle Pacific University. Today, I'm going to be doing a head-to-toe assessment on you. If you have any pain or discomfort, please let me know. So initially, what I'm doing is I'm looking at your overall well-being and emotional well-being. It doesn't look like you're in any acute distress. Throughout this exam, I'm going to be examining your skin, and I'll be looking for any warm moisture, trigger, scars, hair distribution, any lesions throughout the exam. So the first thing I'm going to have you do is I'm going to hold your hands out like this. I'm going to be inspecting the fingers. Let me know if anything hurts here. And I see no bony deformities, no redness, no swelling. Now I'm going to be filling capillary fill, pressing on your nails here. Great, less than 3 seconds. I'm going to have you do this as well. Here I'm looking for the little window, which I see, so negative for clubbing. All right, next I'm going to have you grab my fingers and just resist against me. Good, so resistance strength there is 5 out of 5. Next, I am going to have, I'm going to inspect your wrist for any redness, tenderness, anything there? Anything? No. Now we're going to do radial pulses. Here I'm rate, rhythm, and amplitude. Throughout this exam, I'll always be checking for rate, rhythm, amplitude, and symmetry when it applies. Here the rate is about 72 beats per minute. Rhythm is regular, it's symmetrical, and regular. All right, so now I'm going to palpate up both your arms. Here, just let me know if anything hurts. I'm stopping at the olecranon process, or the olecranon. And then going up the arms to the glenohumeral joint, palpating in the glenohumeral joint. Again, doing the other side, going up, palpating the olecranon, going up the arm to the glenohumeral joint. Any pain or discomfort there? No. Sophie? Okay, so no abnormalities of the arms. Now, the next thing that I'm going to have you do is we're going to do some exercises. So follow me. I'm going to have you place your arms out like this. I'm going to have you turn them down like this. So that is pronation, supination. I'm going to go ahead and have you flex your arms up and extend them out for extension. Good. So full range of motion there. Next, I want to test your strength. So I'm going to have you place your arms like this. Push against me. Good. 5 out of 5. Pull back at me. 5 out of 5. Now I'm going to have you place your arms straight out like this. I'm checking your deltoid. And feeling there, great, 5 out of 5. So I should reiterate what I was doing. This bicep, this was tricep strength, and it was all 5 out of 5. Next, we're going on to your head and your hair. Just looking at the overall appearance of your hair distribution looks great. No infestations. I see no rashes. We're going on to your eyes. Your eyes, I'm looking for any lid lag. I'm looking for any exophthalmos, and I'm also looking for edema, which I see none. Now I'm going to be looking at your sclera. Here I'm going to have you just look out straight. I'm going to pull your lid down. Go ahead and look up and to each side. Good. Sclera is clear. Conjunctiva is, no, conjunctiva is clear. Sclera is white. You're going to go ahead and do this side as well. Good. Conjunctiva, clear. Sclera is white. Now the next part of the exam, Sophie, is I'm going to check your cranial nerve 2, cranial nerve 3, ocular motor 4, trochlear, and 6 abducens. This you're going to follow my finger with your eyes only, okay? Here I'm looking for any nystagmus using the H pattern. Good, no nystagmus noted. Now we're going to be checking for accommodation. I'm going to have you look here at the tip, then I'm going to have you look out, back at the tip, look back out. Good, so there I'm looking at your pupils. They were constricted when you're looking up close and dilated when you're looking far away, which indicates that you have proper accommodation. Next, I'm going to check, I'm going to do the fundoscopic part of the exam, so this little light is going to shine in your eye, okay, Sophie? and I'm going to be looking at the back of your eye. So I'm going to have you just look out straight ahead at the wall, okay? I'm going to be pressing this against you. I see the red reflex coming in. Good. I'm going to do the other side, coming at a 15-degree angle. Again, looking for the red reflex coming in. Good. So I was able to visualize the disc margins, which was clear and sharp. The color was orange of the disc. There was no AV nicking, and there was no bleeding or lesions bilaterally of the eyes. So that completes the fundoscopic part of the exam. Okay, so after I complete the fundoscopic exam, Sophie, I am going to go on to doing the whisper test of your ears. So here I am going to have you cover one of your ears, just one ear, and I'm going to whisper something, and I need you to repeat it.
3, 4, 6.
Good. Okay, and then go ahead and cover the other ear.
Seattle.
Good. So patient was able to repeat the whisper test. All right, and that was the acoustic cranial nerve 8. Now I'm going to go on cranial nerve 8. Now I'm going to be feeling your ears here. Any pain there?
No.
No. Feeling the tragus and the auricular. No pain there. Now I'm going to be looking in your ears. Okay, so for this I need you to hold nice and still. Great. So with the examination of the ear, I was able to visualize the cona light bilaterally. I was also able to visualize the bony prominences. Both ears were pearly gray. There was minimal cerumen and no redness in the ears. Okay. So next, Sophie, we're going to go onto your nose, and I'm going to look in your nose, okay? So just go ahead and tilt your head up. Good. I'm going to look on the other side. Good. All right. With that, I was able to visualize the turbinates on both sides, which were non-boggy. There was no polyps in either nair. The turbinates were midline, and the mucosa was pink. And you said you have no, okay. So do you have any problems smelling coffee when it's being brewed?
No.
No. So that indicates that your olfactory cranial nerve 1 is intact. Now we're going to go on to your mouth. So with your mouth, I am going to go ahead and have you open your mouth and say ah.
Ah.
Okay, good. I'm looking at everything under your tongue, so lift your tongue up. Good. I'm looking, I see no dental caries. There's no leukoplakia, no blocked ducts. There's no lesions in the mouth. I'm going to go ahead and have you stick out your tongue and move it from side to side. I'm checking cranial nerve H12 hypoglossal. Do you have any problems tasting?
No.
No. So that is cranial nerve 7 facial and 9 glossopharyngeal, which is intact. Now I'm going to go ahead and have you open your mouth again. And I'm going to have you say ah.
Okay.
Okay, checking for the vagus nerve, which is cranial nerve 10. I'm looking at the uvula, which was midline. Okay, so go ahead and do that again. Okay, looking at the uvula, which is midline cranial nerve 10 vagus, and the rise and fall of the soft palate was equal with phonation. Next thing I'm going to do, I'm going to inspect your mouth. So I'm going to be feeling inside your mouth to see if there's any lesions. Okay, feeling under the tongue, feeling each of the sides. Okay, feeling the lips, feeling for any lesions there. Okay, go ahead and stick out your tongue. Now I'm going to palpate your tongue. Good, so no lesions noted with the inspection. All right, now we're going to go onto the facial cranial nerve 7. For this, I'm going to have you lift your eyebrows. I'm going to have you go ahead and close your eyes. I'm going to be feeling that. So muscle strength 5 out of 5. I'm going to go ahead and have you smile. Smile really big, show me all your teeth. I'm going to have you frown, and then I'm going to have you puff out your cheeks. Good. So cranial nerve 7 intact. Okay. And now we're going to go on to cranial nerve 11, which is part of the trapezius muscle. I'm going to have you resist, put your arms down, resist up against me. Good. So 5 out of 5 in strength. I'm going to have you put your cheek on my hand and push again. So that's the sternomastoid muscle, 5 out of 5. This was the trapezius muscle, which is 5 out of 5. So cranial nerve 11 intact. Now, cranial nerve 11 intact. Okay, now we're going to do some neck range of motion. I'm going to have you tip your head all the way down. So flexion, have you look up at the ceiling, just follow my moves, look up at the ceiling. So that was extension, head side to side. Good, so that was rotation. Now I'm going to have you ear to shoulder, which is lateral rotation, which, so neck range of motion intact. Okay, neck range of motion intact. Now I'm going to have a glass of water for you to take a sip of water. Place the water in your mouth. Put some water in your mouth. Don't swallow. Okay, go ahead and swallow. I'm looking at the trachea, which is midline and no swelling noted. So now the next thing, I'm going to have you hold the water and I'll have you drink again in a minute. I'm going to be checking your thyroid gland here. I'm going to be placing my hands around your neck, okay? Go ahead and take a sip of water. As I place my hands, leave it in your mouth. Oh, take another one. Good, okay, felt it. Okay, just felt it. Okay, so I'm feeling the thyroid gland, I'm feeling the isthmus, and I'm feeling each lobe, and I do not feel any nodules. Good, okay, so done with that. All right, so Sophie, the next thing that I'm going to do is I am going to check your
Heart rate.
no, I'm going to check your neck. Here, I'm just going to be palpating your spine all the way down, looking for any step-offs. Any pain here?
It tickles.
Yep. Any pain?
Nope.
No? Okay, great. So no step-offs, no bony deformities. Now I'm going to do the paravertebral muscles. Again, I'm just going to be palpating here. I'm looking for any lumps. I'm looking for any spasm or any pain. Any pain?
Nope.
Nope. So no, nothing noted there. All right, now we're going to listen to your lung sounds, okay? So every time I touch my stethoscope, the bell of my stethoscope to your chest, I need you to take a deep breath in and out throughout your mouth, okay? Just relax. Deep breath in and out. And again. Again. Sophie, come on.
Sorry.
Again. 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 Okay, now I'm going to be doing the right lobe again. And again. Good. Okay, so the lung sounds were clear to auscultation, no wheezing, bronchodesicant in nature in the sounds, no rales, no wheezing. Okay, the other thing I'm going to do, I'm going to have you take a deep breath in and out. I'm just going to be looking at your respiratory pattern of your back. Good. Now I'm going to check for expansion. Sit forward for me just a little bit. Come on, Sophie, please. This, I know, but I'm being tested. Okay. Take a deep breath in and out. Good. So my hands rise and fall symmetrically. Go ahead and sit back. You know how you're both ticklish. Okay. Now what we're going to do, Sophie, is I'm going to listen to your lung sounds from the front. So again, placing my stethoscope on you in and out throughout your mouth. Breathe in and out deep through your mouth, not your nose. Good. One more. Good. And one last time. Good. All right. So again, no audible wheezing, no audible sounds or bronchiovesicular. Now I'm going to be listening to your heart sounds. So I'm going to be finding the second intercostal space on the sternal border. I'm going to be listening at the aortic. Just breathe normal. Going to the left side, second intercostal space, sternal border, listening for the pulmonic, going down to the third, fourth, and fifth, listening. And there I'm listening for the tricuspid as well as the right ventricle, going on to the fifth intercostal space, mid-clavicular, listening to the mitral valve as well as the left ventricle. Normal S1, S2 noted, no S3. 4 rhythm was regular at about 72 beats per minute. Okay. Okay, I've hit the wall. Okay, so now we've gone on, we've listened. Oh my goodness, okay. I feel like I'm forgetting something, but for the sake of me forgetting something, I'm going to have you do the cerebellar function, which is the alternating rapid movement. So I'm going to have you follow me, this, okay, and do it fast. Good. So looking at the rate, rhythm, and symmetry, which is normal and intact. Now we're going to go ahead and check your reflexes. So the first reflex that we're going to be checking is the brachial. And that was 2 out of 2. No, the bicep. Sorry, bicep. Good. 2 out of 2. 2 out of 4. Relax. 2 out of 4. Then we're going to do the tricep. Go ahead and relax. That was a 1 out of 4. Go ahead. Try to relax. Okay, Soph? And this is the tricep. Good. Oh, that's a 2. 2 out of 4. Now we're going to do the brachial radial. Okay, hold on. Just relax. Good. 2 out of 4. Good. 2 out of 4. Then we're going to do patellar. Ooh. 3 out of 4. Then we're going to do ankle. Good. 2 out of 4. Other ankle. 2 out of 4. Great. So, now I do recall what I forgot. We're going to do some range of motion exercises for your shoulders. So what I'm going to have you do is place your arms out in front of you. I'm going to have you cross them over your chest like this, and that's adduction. Bring them all the way out for abduction. Good. Then we're going to have you take it and place them behind your back for internal rotation, looking at the height. And then follow me, hands over your head and behind your neck. Again, looking at the height, looking for how far it goes up. So good range of motion of the shoulders. Did I have you do head and neck range of motion? Yes,
Yeah.
I did. All right. So, Sophie, now we're going to go ahead and inspect your breast. So I'm going to have you put your hands on your hips and just kind of suck in. Good. Looking at your breast symmetry, looking at the shape, the size, the contour, looking for any notable lumps, looking at nipple retraction, looking at orange peel sign. Okay, now all the way up over, again, looking for those same things, symmetry, size, nipple retractions, orange peel. Good. Didn't see anything there. So negative for any of those signs. I'm going to go ahead and have you lay down for me. Okay.
Yeah.
Yep. Lay down for me, sis. So here I'm going to be doing the breast examination, Sophie, and I'm just going to be simulating, okay, over top of you. First I'm going to have you place, scooch all the way down. I need your head flat. I need your right arm up over your head. Here I'm going to be starting at the talus fence using 3 fingers, palpating light, medium, deep, all in the axillary area, going in a horizontal pattern all the way up to the clavicular area, rotating down, making sure I'm getting all the tissue at the nipple line. I'm making sure there's no nipple drainage, going up, all the way over to the sternal border. Once I get there, I'm gonna go to the other side. On the other side, I'm gonna have you place your arm down, place your arm up. Okay, again, starting in the talus fence. I'm gonna be feeling, starting in that axillary area, going all the way down, following a pattern, a horizontal pattern, going all the way up to the clavicle, going all the way down, all the way to the mid-sternal border. Okay, so no lumps noted. I was looking at the patient's face to see if there was any grimacing, which I did not see to indicate any pain. Did you have any pain during that exam? All right, so no lumps. Okay, and the tissue is smooth. So the next thing I'm going to do, Sophie, is I'm going to be checking your carotid pulses. All right, so I'm going to be doing this one at a time. This is on your neck. Good. So rate about 72, 2 out of 4 for amplitude and regular. I'm going to check the other side. Good. Rate 72. 2 out of 4 and regular. And now I am going to go ahead and I'm going to check your carotids for any bruise. Okay, this is just going to be placed on you. Checking both sides and negative for bruise. Now I'm going to go ahead and I'm going to check I'm looking for any heart murmurs, mid-clavicular, no, right, second intercostal space, aortic, left, second intercostal space, pulmonic, left sternal 3, 4, 5, tricuspid, looking at mitral, mid-clavicular, fifth intercostal space, and no murmurs noted. Now I'm going to be checking for the apical impulse here. This is going to be, okay, so we right at about the fifth intercostal space, mid-clavicular, and it is regular. It's not displaced. The and its normal size less than 2.5 centimeters in size. All right, so next, Soph, I'm looking at your overall chest, looking to see if there is any heaves, which I do not see. So that's the pericardium that I'm looking for. Now I'm going to be just doing your belly. Here I'm just at first inspecting, looking for venous pattern, looking for any visible lumps, looking for any striae. Okay, and I do not see any of those. So next, so the first thing that I'm going to do is I'm going to be listening at your arteries for any, I'm going to be listening for any bruits. So the aorta, and then I'm going to do renal, and then iliacs, noting no bruits. Next, I'm going to be listening for bowel tones, and I'm going to listen to all 4 quadrants. Great. There is obvious, there's normal active and gurgling throughout. The next thing I'm going to do is percuss your abdomen here. I'm looking for dullness or tympany. I'm going to be doing the 9 regions. Okay, good. So I'm hearing timpani throughout, except for some dullness over the sigmoid colon. Next, I'm going to be doing light palpation. Sophie, this is just going to be some light palpation. I'm watching her face to make sure she's not grimacing. I'm looking for any guarding. I'm doing all 9 areas, all the 9. Okay, now that was 1 centimeter deep. Now I'm going on to deep palpation, which is 3 centimeters. A little bit deeper, okay? Any pain?
Nope.
All right, so no pain there. Good. Just feeling, okay, no lumps, no pain noted in the abdomen. All right, next we're going to go on to your liver. So here I'm going to be using the hooking method. Take a deep breath in for me. Good. Blow it out. Deep breath in again. Good. Not palpating the edges of the liver, meaning no heat, no enlarged liver. Now I'm going on to the spleen. Go ahead and relax. Deep breath in, blow out. Another deep breath in, blow out. Not feeling the spleen, the edges of the spleen. Next, I am going on to the femoral arteries, feeling, again, right rhythm, amplitude, and symmetry. Rate of about 72, 2 out of 4, and symmetrical. Then I'm going to be feeling for any inguinal lymph nodes, which I'm not palpating any inguinal lymph nodes. Next, I am going to go on to the legs and the hips. So feeling the hips, any pain there.
Nope.
Going down to the quads, the patella, going down the shins. Looking for any bony abnormalities, and also doing the calf at the shins. I'm going to be pressing for and looking for any pitting edema. Also going to feel the feet. Okay, going down again, the other quad, the patella, going down the shins, looking for the edema, going down the calf, looking for any redness or tenderness, and going down the foot. Any pain there at all,
Nope.
Sophie? All right, so now the next thing we're going to do is I'm going to do some passive range of motion. So just relax your legs. I'm going to be doing the work here. I'm going to bend your knee up. I'm going to straighten your legs out. So flexion, extension, relax. Okay, then I'm going to be doing abduction, abduction. And then I'm going to be doing some rotation. So external rotation of the hip, internal rotation of the hip. Any pain?
Nope.
No. Going on the other side, I'm going to be doing the same thing. So I'm going to be flexing your knee, extending. Then I am extending. Then I am going to do abduction, abduction. External rotation, internal rotation of the hips. So full range of motion of the hips. Now I'm going to go on down to the feet. Moving my camera here. I'm going to be feeling for the dorsal pedalis pulse, which is 2+, rate about 72, regular and symmetrical. Now we're going to do some range of motion of your feet, Sophie. I'm going to have you pull your toes up, so dorsal flexion. I'm going to have you point them down towards me, so that's plantar flexion, good. Then I'm going to have you put the bottoms of your feet together, good, so that's inversion. And now go ahead and put them out normal, and I'm going to have you touch your toes together, inversion. So full range of motion of the ankles and lower extremities. All right, so Sophie, now that we're done with that, I'm going to go ahead and have you sit up for me and bring your legs around. And dangle them over. So there is one thing that I do want to go ahead and do that I forgot to do is that I left out. I'm going to check your lymph nodes. Okay, so I'm going to check pre-auricular, post-auricular, tonsillar, submandibular, submental. I'm going to be doing superficial cervical, going deep cervical. Then I'm going to be doing posterior cervical, supraclavicular, and infraclavicular. Good. So I did not palpate any lymph nodes there. So if I did, I would be looking for if they were firm, if they were tender. I would be looking to see if they were fixed. All right, so Sophie, now the next thing that I'm going to have you do is I'm going to have you stand up. I'm going to be looking at your spine, so I'm going to have you face this way. Here, I am looking at your spine. I'm looking at the curvature, so concave in the cervical and lumbar region and convex in the thoracic, which is what I see. I'm gonna go ahead and have you bend forward and touch your toes so we're flexing. I'm also looking at the spine to see if there's any scoliosis. Go ahead and stand up so I don't see any scoliosis or lordosis or kyphosis. Now I'm gonna go ahead and have you extend your back. So go back, good, so good extension. So full range of motion. Now, Sophie, I'm going to be holding my hands here. I'm going to have you just rotate your shoulders from side to side. Good. Go ahead and place your arms down. Now I'm going to have you place your arms on your thighs, hands on your thighs, and follow what I'm doing. I'm going to have you go like this and this. Here I'm looking at the level of the hips to make sure they are even, which they are, and she had good range of motion of the hips. So now I'm gonna have you walk. I'm just gonna have you walk across the floor. Here I'm looking at her gait. I'm looking for her balance. I'm also looking at any leg lag. Go ahead and walk across on your toes. I'm looking for any shuffling. Okay, back on your heels. I don't see any shuffling. I don't see any wide stepping. Now I'm going to have you do tandem walking, which is this. Okay, good. So balance is intact. Good. So come on back. And then there's one last thing I'm going to have you do. So face the camera here. I'm going to have you bend one knee up like this. And then I'm going to have you bend the other knee down. Good. So we're looking at strength. So muscle strength of the legs. Let's do the other leg. Go ahead, good. So good full strength of the legs. All right, so now you can go ahead and have a seat. I have to talk through a couple other things. First, it's going to be the male and female genital urinary. First, I am going to see how much time is left. Talk about the male. So the male, I'm going to
8 minutes remaining.
Perfect. So when the male comes in, the first thing that I'm going to do is I'm going to wash my hands in front of him, place my gloves on. I'm going to be seated. He's going to be standing. I'm going to be examining the perineum area. I'm looking for any infestation, rashes, lesions, warts, anything like that. Looking at the skin color. Then I'm going to be palpating the shaft as I get down to the tip of the penis, if he is circumcised or not. If he isn't circumcised, I'm going to have him retract his foreskin. I'll be looking at the urethral meatus, looking to make sure it's in the right place, make sure if there's any drainage, any sores. And after I do that, then I'm going to examine his testes, each separately. First, I'm going to be feeling for any lumps, doing the left and then the right. Then I'm going to be feeling the epididymis on one side, then the other. Then I'm going to be looking for the spermatic cord on one side, going to be feeling for the spermatic cord, and then I'm going to follow it up to the inguinal ring. I'm going to put some pressure, ask him to cough, feeling for any bulges, negative for hernia. As I do the other side, following the spermatic up, again, inserting in my finger near that inguinal ring and having him cough, and negative for hernia. Now, once that is done, I'm going to go ahead and I'm going to stand up. I'm going to have him lean over the table with his elbows on the table. Here, I'm going to make sure that it's okay that I do this examination. I'm going to be inspecting the outside of the rectum, making sure that there's no fissures or hemorrhoids. I'm going to be lubricating my index finger, and I'm going to be inserting my finger in, telling him to bear down as I insert my finger, telling him that he might feel like he needs to have a bowel movement, but he's not. I'm going to be feeling for sphincter tone. I'm going to be turning my finger, examining the posterior, anterior, and the lateral positions, looking for any lesions or lumps. And then on the anterior side, I'm looking for the prostate, which should only be protruding about 1 centimeter in. Should be about 1 centimeter. I'm feeling for the sulcus and each of the lobes. I'm feeling for any nodules. I'm feeling for any any lumps, and it should be non-tender. Once I am done with that, I'm going to pull out my finger and give him a tissue. Now we're going to go on to the female examination. With the female examination, I'm going to place her in the lithotomy position, draping her so that I can see her face. I'm going to be telling her when I'm going to be touching her, so that she knows that I'm going to be touching her. I am going to wash my hands, place my gloves on. Then I am going to first inspect the mons pubis, looking for any infestations or rashes. I'm looking at the labia majora, labia minor. I'm looking at the interosseous. I'm looking at the perineum. I'm looking at the urethra. I'm looking at the clitoris, looking for any lesions, rashes, redness, swelling. Then after I've done that, I'm going to go ahead and get my speculum. It's been soaking in warm water for lubrication. Add a little bit more lubrication. I'm going to insert my fingers in the posterior part of the vagina, letting the patient know that I'm doing this. I'm going to be inserting the speculum at a 45-degree angle with a slight downward pressure. Once I get it all the way in, I'm going to rotate it horizontally, and then I'm going to slightly open it up to see if I can see the cervical os. If I can, I'm going to lock it. I'm going to be inspecting the cervical os, or the cervix and the os. I'm looking for any redness, lesions, bleeding. I'm also going to be looking at the vaginal wall for the same thing. Once I am done with that, if I needed cultures, I'd gather them now. Then I would go ahead and slightly pull the speculum out. Once I pass the cervix, then I would unlock it and close it with downward pressure, and remove the speculum. Then I'm going to be telling the patient that I'm going to be doing a bimanual exam, removing my left-handed glove. I'm going to be lubricating my index and my middle finger, and then I'm going to let the patient know that I'm inserting my fingers into her vagina. I'm feeling the cervix for any cervical tenderness, watching the patient's face to see if there's any grimacing. I'm going to be feeling it for any lumps. I'm going to be feeling the walls of the vagina for smoothness or any induration. Then I'm going to feel the size of the uterus by placing my ungloved hand on her abdomen, pushing up with the cervix to see the size of the uterus. I'm going to see if it's fixed or firm, or soft or tender in any way. Then I'm going to feel for the adnexae. I'm going to be rotating my fingers to the right. With my other hand, I'm going to be scooping the lateral part of the abdomen, scooping, trying to capture the ovary, which should be about the size of an almond. It should be non-tender, but she might have a little bit of twinge of pain when I capture it. And I'm going to be feeling for any lumps. Then I'm going to go on to the left, doing the same thing, swooping motion, capturing the ovary, feeling size, location, making sure that it's not fixed, and then also feeling for any lumps. I'm going to then retract my fingers. I also forgot to tell you that I was going to be looking at her anus at the same time that I was inspecting the whole perineum to make sure that she did not have any hemorrhoids. And that is the end of my examination. Thank you.
You only had to do that on Sophie?
No.
No, I just have to explain it.
I was like, yikes, so if I could volunteer for that.
Yeah, we kind of had to.
I'm making everybody do this.